Hello, everyone. Welcome to this episode. Today, I'm joined once again by Bodine and Ledden, myself here, Shaun Brewster. Had a little bit of a break over Christmas. Bo, your beard's looking really good. Are you copying me, or is you trying to do your own thing?
Oh, nah, it's got to go. This is about as long as it can get before
Yeah.
I get a bit annoyed with it. And
Got that rugged kind of look about it. I don't know whether you want to get rid of it just yet. It's good. Anyway, we will get onto the topic today. So, a bit of a wide-reaching but very interesting topic, at least for us today, which is around learning styles, education. We both saw something on social media a couple of days ago about the differences and benefits with regards to mentoring versus learning in a formal sort of setting versus reading research, all these different styles, and people have different preferences and different beliefs around these things. Both done a little bit of reading, found a whole heap of interesting information about this, and thought we'd have a bit of a chat about it today. So that's where we'd start. So, but let's get started first of all, maybe around the differences between those three things. So, learning via reading research, via participating in mentoring, either as the mentor or the mentee, but also undertaking formal education. Where do you see the pros and cons in those three things?
yeah, well, I think they're all good. They're all different, and I don't think any is better than the other. And when we consider the way that we learn, we need different types of input, so different types of information that can help to strengthen our learning and our understanding. So if we think of sort of developing a neural pathway, a neural connection, we need to have different synapses and different associations with different types of information that helps to solidify our understanding. So if we only read something, then that's all we'll really know how to interpret. But if we read something, we do something, we hear something, we start to get more of a stronger neural connection, which helps to solidify that learning and understanding. So this gives us much more of a broader understanding and the ability to reason and analyze and critically think when we have more of these neural synapses working together. We engage more of the brain and we understand a topic with a lot more depth.
Yeah, I think that's the key word there, isn't it? Depth. And someone can teach you a technique and say, look, this is how you mobilize this particular level of the spine or whatever it might be. And you go, cool, I can do it. And you can repeat it. Monkey see, monkey do, right? Or someone can describe it to you and then you might be able to describe it to someone else. Or you might, observe it and kind of get an understanding about positioning and so on. But when you actually go through all those processes of being able to talk about it, being able to understand the meaning behind it, being able to do it and physically explain it and perform it, that's the depth that we're talking about. And I think that's really important. So for anyone who's got that bias towards a particular style of learning, whether it be mentoring, whether it be, I just want to read a textbook, whether it just be on YouTube, that's all good and well. But we've got those biases for a reason, because that's the style that feels easy and comfortable for us. But learning is much more about just being comfortable, isn't it? You got to challenge yourself.
Yeah, and that's the thing. Those learning styles are a preference, and there's absolutely no research to say that we should adapt a teaching style to fit a particular preferred learning style.
Now that statement just upset thousands and thousands of students and teachers, right?
Yeah, well,
Not adapting. This is an interesting thing. You brought this up before, but it's been my belief for the longest time that we should try to adapt our teaching styles to fit the student, which is near impossible when you've got a group of 20 or 30 people and they all learn in different ways, right? But that's what we were taught to do as teachers.
yeah, and it's a neuromyth. So if and in fact, probably over 90% of the population, as far as education or educators, understand that, yeah, you've got your visual, your auditory, and your kinesthetic learners primarily. But we learn best from different forms of information. It'd be like thinking about learning as a scaffolding system. When we build a scaffolding system, all right, we start to then attach more posts or poles to that scaffolding system. So we start to branch out with more synapses, right? So we need to connect that learning to our previous understanding, our previous experiences, and then we can start to gradually build on that. So the more things that we connect through association, the more, I guess, the more synaptic connections that we'll have and the better understanding we'll have of a topic. If we only had a scaffolding system that was from one form of information, let's think about this just being a straight up and down scaffolding system. But then someone asks you a complex problem that doesn't quite match the way that you were told, because you've lost the ability to critically think and analyze because you've only had this one form of information. Then when someone asks you a question that may not fit that approach, it's very hard to analyze, interpret, and reason what that may be, the answer or the response to that. So that's why we need different forms of information to build these synaptic connections and build our understanding, so that we can then critically analyze and sort of create a response by not just having one understanding of a topic. So yeah, it's really important to have different forms of information. So I even think about that, you know, if you're learning something, like you might be teaching me something, we'll have a discussion, I think, I'm not quite sure on all of that. So I'll go away and read a little bit, and then I'll start to think, okay, well, that's starting to make a little bit more sense. Let's go through it in a practical form. All right, yeah, I'm really starting to understand that a little bit more. Then we discuss it, and I might challenge certain things, and then you might put forward a different argument, and we go back and forth. So we're starting to analyze, reason, interpret all of this information based on different formats, versus if you just told me this is the way it is and I didn't question it. So, okay, it is what it is. That's not allowing me the ability to problem solve and critically think and analyze that information.
Yeah, that's good. And I think that sort of is a perfect explanation or painting a picture of like an early stage learner to someone who's more advanced. As an early stage, we very much learn in a mentoring type style. We have our teacher, usually in a class, not usually one-to-one, but we'll have a teacher and a student. The teacher tells us things, we take it on board as fact, and then we go and parrot those things and just perform them as we're taught. And that's probably a reasonable place to start for most learners, because we have to start with the foundation of something. And so that puts a lot of faith then in the education system and our educators to actually give us the right information, which is a little scary because we know that not all the information coming out of undergraduate programs is as current and as accurate as it should be, but that's where we start. And then as we go through our career, our life cycle in this industry, hopefully what happens is we start to see things that don't necessarily match with that original model, and we start to challenge that and question it. Now, a lot of people, I think, don't challenge and question. They think, well, that what I'm seeing and what's challenging my understanding must be wrong, or I must be looking at it wrong, so they'll dismiss it. But I think anything that doesn't match our model of understanding needs to be challenged. And in fact, even if it does match, we should probably challenge it and have a think about it and go, what else could there be? And so you've got this scaffolding, right? You've got this wider foundation. You need to build a really wide base to it so it's strong at the bottom. The more you question, the more you challenge things, the more you discuss things, the broader that base gets, and then the higher you can build it. So that's a good analogy. And I think if we come back to mentoring again just quickly, it relies on this very much a trust situation, right? You've got someone who's open to receiving information and someone who's open to giving it. And if that relationship is very much a hierarchical one, you'll receive information, you'll be expected to take it on board. But not all mentoring relationships are as reliable or as built on quality as they possibly could be. And I think that we need to, because of that, diversify our learning. Have a great mentor. Find someone who is on the same path as you as far as philosophical approaches to things, and also in the way that you view your clinical practice. Find one of those, at least one. Read research to challenge or support everything that they are teaching you, and find other new things as well. And then do formal education, whether that be professional development or other formal qualifications. But all of those different styles of learning mix together to give you that broad kind of scaffolding base. And I think that's really important, that we don't just go with our own preferences, like you were saying before. Don't just go with the stuff that's easy or comfortable, because you'll find yourself in that really narrow column of information that has the ability to just fall at any time.
Yeah, exactly. I couldn't agree more. And that's really building that scaffolding is key, that base of information. But yeah, you got to challenge those ideas. If you had a mentor and you only listened to their information and held that to be 100% factual, and they weren't staying up to date with current evidence and best practice, then that information is trickling down that's outdated and uninformed. So I think, yeah, there's certainly aspects to different types of information. And when we look to the literature, there's no correct answer. That's why we've got to be across as much as we can, because there's different ways, there's different approaches, different populations that research is done on. So it's important to understand, be able to read something and interpret it. Understand what is it meaning, how does that apply to my patients in my clinical setting? Because if someone told you this is how you treat shoulder pain, and you go, okay, well, it is what it is. But if you said, but why? What's your reasoning? What's your rationale? What's the mechanisms behind this? Why are we getting this effect? And what happens when we don't get this effect? Really being able to critically analyze it and think more laterally, that is the key to being a really good clinician.
Yeah, and finding a teacher who's willing to have that thrown back at them is the hard part, right? And this has been a steep learning curve of my own over my career as a teacher, and I'm sure you've seen the same thing. Like in the early days, students will just take everything you say as gospel.
Yeah.
And obviously that's a lot of responsibility to make sure you're giving the right stuff. But every now and then someone will turn around and go, hang on a second, why? Or that doesn't sound right. And unless you know that you can answer them confidently and competently and give it like the actual answer to that question, then you should be able to take a step back as a teacher and go, hang on a second, maybe you're right. Maybe I'm missing something here. Let's have a look at this. And it's removing the ego from the exercise. And look, you've personally put me in that position lots of times, and I love it. I love it when we have those conversations, and I'll be showing you something maybe that you hadn't seen before, or vice versa. And then you'll say, oh, but this, and this. And I'll think, it's a really good point. That's a facet of something that I didn't know. So now let's go and look at that. And we do that together and we build each other's knowledge. That's a useful learning relationship. But unfortunately, not everybody has that. So if you've got a teacher who says to you, that's just the way we do it, or this is the way I've always done it and it always works, you get any kind of answer like that, run for the hills.
Yeah.
Like that's a red light right in front of you right there. So be cautious.
Yeah, well, this works, and I've always done it this way. But that's a good point, where I've learned so much from teaching new students, because they ask questions that I've never actually thought why. And look, I don't know. Go back, read it, research. You learn from your mistakes. And that's the best thing. It's okay to be wrong and admit you're wrong. In fact, most of the best researchers, the stuff that they're putting out now, they've gone back and said, the stuff that I was putting out 10, 15 years ago is incorrect. And that's the importance of developments in science and research and staying up to date with all of this stuff is key.
On that topic too of staying up to date, we were talking a little while ago about before this recording about how it can take quite a while for research to get into clinical practice, and that's a downfall in our education system possibly. And you made a really good point that that those facts around that, the figures around 16 years on average or 17 years on average to get from the clinical research lab to clinical practice is about the time it takes. But when those figures were getting thrown around, that was pre-2000s, right? So that was before we had the access to the information that we have today. It's a different world now. The speed of transition of information creation or acknowledgement of information to the application of it is much faster than it used to be, don't you think?
Yeah, exactly. And, that's another one of these myths or a misconception that research takes 17 years to get into clinical practice. Firstly, the paper that's being referenced here was done in 2011. Most of those studies predate 2000. and these trials were done on research for cancer, HIV, a lot of drug testing, which, has to go through FDA approval, the ethics committee, and there's such broad research here that's, I don't know that really applies to what we do nowadays. So that's a real misconception. It's not from the publication date to implementation that takes 17 years. It's from that conceptualization of the development of that drug through to all of those processes that it goes through. But now, we've got the development of the internet. After that, databases like PubMed, Pedro, we've got YouTube, we've got podcasts, social media, we've got information coming out of our eyeballs. So, I think that's really quite outdated to say that 17 years is how long it takes to get into clinical practice. I'm regularly looking at that literature from last year that, is being applied into our courses and applied into what we do. So, I think, sort of reading into the methodology of research is key. And really, again, looking at these types of papers and just thinking, what population was it done on? Or, what does that mean? Does that apply to me? Or, start to pull that apart a little bit. And that gives you a bit more understanding of the relevance.
Yeah. And I think that you're right. It's depending on the context of the research too, it can take longer or shorter. And I agree that the kind of work that we do, manual therapy, kind of exercise therapy, clinical practice work, shouldn't take and doesn't have a reason to take as long to get from the research setting to the clinical setting, though there are certainly examples of things that should be being done across the board in clinical practice now, but that aren't. Classic example would be the groundbreaking stuff that happened with tendon research here in Australia. And it'd be around about 10 to 12 years ago now that the crux of that was kind of conducted, I believe. And so, a decade, and it's still not widespread in clinical practice. So it's not that it hasn't gotten there. It is in clinical practice. I see, and I know a lot of therapists that are using it. It's great. Me included, great results, but it's not across the board. So it's not being taught everywhere. So it does tell us that things do take a while. Some things take more than others. And there's multiple reasons for that, of course. Like, I learned it because I read research and went and learned from someone who knew it. Other people will learn it because they'll come to our courses. Other people go and learn from the researchers who are running courses and so on. But unless everybody does that training, well, then it's not going to get into every clinical practice. And until it's taught in every undergraduate program around the world, it won't be across the board in clinical practice. And this is why there's so many differences between a physio course in Queensland versus one in Melbourne, an osteo course in Melbourne versus one in New South Wales, and so on and so forth. So the people who are writing that content, those curriculum developers, if they'd all done exactly the same training, read all the same research, attended all the same PD, got mentored by all the same people, then yes, it would be across the board. But obviously that's a ridiculous expectation. And so all we can do as clinicians, as health practitioners, is to do as much of our own learning as possible, employed in our own clinical practices. If you're a teacher like us, well, then we try to teach it to as many people as possible, keep it as current as possible. And then that's how our patients benefit. That's how it gets out there. And any kind of grand sweeping generalized statement like it takes 17 years to get from the research lab to clinical practice, well, maybe on average in some situations possibly it'd be that number, but it's too generalized to make that statement, I think.
Yeah, definitely. We've advanced so much in the last 10, 20 years, so it's really is developing, and we've got so much access to it. I remember in the 2000s, we still were using dial-up, we're saving information on a 3.5-inch floppy disk. No one had a smartphone sitting in their pocket. We've got such easy access to this information. When I was at school, we had to go down to the computer lab to do some research. So, or, look for a journal reference and then go and find where that journal is in the library. So the accessibility to this information is just, it's everywhere. So there's, I even, if you look at, say, PubMed, for example, you can put in your preferences, and you'll have email updates sent to your inbox. It's really that accessible to stay up to date with this stuff. And there's so much information out there. It's impossible to stay up to date with all of it. But reading a paper a day, a week, however you go about it, that keeps you informed to best practices, and moving away from outdated understandings and these myths that sort of are dragging the chain on the profession moving forward.
Yeah, that's a good point. And I think before I move on to the next point, just to kind of recap what you just said, but reading research on a regular basis is good. And I think a lot of people who are anti, if you want to put it that way, anti the research, and they want to go purely on their own clinical experience and exposure, you don't have to read every research article and take that as gospel. Not everything in the research should be applied clinically as the only way to do things. You can read 3 different research articles on tendinopathy of the elbow, and they can all give you 3 different perspectives, different approaches for assessment, different approaches for treatment. And you use all 3 of those in different ways to give you that broader understanding, that wider base of understanding. Now, you might find that one of those approaches gels better with your understanding and how you like to work and how you think your patients present and so on. And you can kind of use that more than the others. But if you don't read the others, you've only got one perspective. And that can be a little dangerous and a little limiting. So I think, you don't have to go, it's all research or it's none at all. It's research and other things.
Yeah, that's it. And, but being aware of avoiding your biases and only reading information that does match your confirmation. There's so much conflicting stuff. And at the end of the day, you look at it and think, well, you know what, let's explore other avenues, preferences, what's worked for them in the past, what the research says, your experiences. So it's combining all of that together, not just, using a specific method that they used on a specific population group in that particular paper. So, but it's really useful to understand what worked, what intervention over what period of time, really starts to broaden your understanding on a particular topic.
Yeah, great. I think some of our listeners or viewers might have seen that triangle of learning where you've got that it sort of goes 10%, 20% as you go down this triangle, and if you see something, you only maintain sort of 10% of it. If you hear of it, you maintain 20%. It's some combination of those things. If you physically do it, it's 30 or 40 or 50 or something, and then right down to the bottom, if you're sort of participating and asking questions and moving through it, then it's sort of 80 or 90%. It's a Dale's hierarchy of learning or something like that, but it basically describes the type of learning you do. If your style of learning is very narrow, well, then you forget most of it. And if it's broader, you remember more of it. And that's a nice way of looking at things. But I think, this as well, it's a flawed concept because, one, who could have possibly measured that it would be exactly 10, 20, 30, 50, 70%? Like this human body and the human mind doesn't work in those exact numbers. And those as numbers, when you look at the research, were never actually there. Someone's exaggerated this concept, right? They kind of blew it out of proportion.
It's completely inaccurate. It was actually designed for the loss of sensory information as you go up the triangle, and someone's just added numbers to it. So to say that you only absorb 10% of what you read is just complete crap. But it's the combination of it. It's like anything. If you have just purely passive, if you just listen to something, that's very passive. If you just read something, that can be fairly passive. You need to maintain your attention. So learning needs to be something that engages your attention, because you can quite easily switch off, and then there's various filters that information doesn't quite go through anymore. So, but then you need to generate some form of thinking about it, some form of, rationale or problem-solving ability to start to get those different brain centers working together. So yeah, just to say that you only absorb 10% of what you read, and that the best way of learning is by doing something. Well, I could attempt to build a house and not have any idea of what I'm doing, but if I read the plans and I understood, and then someone advised me, different forms of information give me a much better understanding of what's going on.
Yeah, for sure. And that's a really good point. I think that we look at these kind of facts and figures and graphics and things that we see and we go, oh, that kind of makes sense. Yeah. But again, we've got to challenge that too, right? This is what we're talking about. Challenge it, have a discussion about it. Why is that the case? I was doing some reading about this little while ago, and I found some nice points here that I think are nice ways to avoid those pitfalls or those traps of only learning in that singular column style of one sensory input. One of the things that I picked out that was quite interesting was it's a good idea to align the learning and performance contexts. So if, for example, and we try to use this I'll give you an example from our dry needling courses is a good example, because we have some assessment in there along with practical training. And so we try to align the learning and the performance context. Now, the performance context is do dry needling in a clinical setting on a real patient in real time. So you're thinking and doing and trying to understand things in real time. Now, the assessment context, if it was taken out of context, it would be in a written assessment, right? Because you're not going to do dry needling in a written format. So if the assessment was purely written, that would be outside the context of that. But we do observational assessments. The students learning dry needling, we're asking them questions about that during the actual application. They're communicating with the patient in real time, answering questions, and we give them scenarios where they have to kind of role play out a situation they might need to manage. All of that's in the context of the learning environment. I think that's a good example, and you can do that in just about any kind of skill set that you might be learning. Perform it, and then if it needs to be assessed, assess it in that same simulated environment. I think it's a good way to do it.
Yeah, there has to be relevance attached to information. So again, back to sort of those neural pathways, that we create more synaptic connections if there's other associations, and that could be relevance, that could be emotion, the reasoning. So if I told you a fact about the supraspinatus goes underneath the acromion, all right, towards the humerus, yeah, so what? That's important because of, rotator cuff related shoulder pain or supraspinatus tears, whatever it may be. There has to be a relevance. So you go, okay, well, if I think of tears, I think of the anatomy of where that muscle is going. So you start to associate a few things together. It might be that if I was introduced to you, Shaun, and I remembered glasses, and then but I forgot your name, but I associated glasses with Shaun. Now I'd see glass on Shaun. So that neurons that fire together wire together. So attaching relevance or some form of association to the fact or the content that we learn, that's key.
Yeah, right. No, that's a good point. And the context is key, and it sort of brings to the next point, which is provide retrieval practice, but do it in the context of the situation where you would need to retrieve that information. And so, again, another classic example is we did this in high school, right? You're learning maths, you're learning English, science, whatever it might be, and we have lots of written assessments. Now, if that's a skill set that you need to use in a workplace, and your requirement to retrieve the information allows for you to sit and think about it for 5 minutes and then write it out slowly and come up with your answer that way, it doesn't really prepare you for clinical practice, which we see so many of our high-performing academic students do really well at school, get into clinical practice and struggle because they can't retrieve information quickly and do it while doing something else. And you'll see it when you're receiving a treatment. Someone's giving you a really great treatment and you ask them a question, they stop and they give you their answer, and then they start treating you again. You think, I just want you to keep doing both at the same time. And obviously that's a higher level of skill and understanding that you develop over time, but being able to practice retrieving information while in the context of doing the thing that you need to do in the situation that might have some stress, some immediacy of information requirement, lots of things to manage. So building up your ability to retrieve information in that kind of multifaceted environment is really useful as a clinician, because there's so many things going on in the client consultation.
Yeah, definitely. There's this, that's sort of where we need to really be more efficient at accessing this information. And that's the key. So if you learn a piece of information, um, it's not a very strong and efficient neural pathway. But the more that you access it, the more that you retrieve that information, the stronger and the more efficient that neural pathway gets. So you get better at retrieving that information.
Yeah.
The more things that are associated to it means that it's much easier to retrieve. So yeah, I think that's the key. It's you try to learn anything once in just one session and think that you're going to hold on to it. Yeah, well, you probably won't. Because repetition is key. Repetition, adding relevance to it, the more association to that information, the more that it's utilized, the better that synapse gets, and the more efficient that neural pathway gets. It's a process called pruning, where you might have all of these different neurons, but the ones that you use the most or become more efficient, and those other neurons or the synaptic connections tend to die off, and they're not used anymore. You don't use it, you lose it.
Yeah.
The more that you repeat something, the more that you go over it, the more formats that you go over it in, the better you get at understanding and learning it.
Yeah, and that's perfect. That actually leads into the last point that I had, which was the idea that we should provide spaced repetitions. So the ability to retrieve information in the right context is one, but being able to do it on multiple occasions that are spaced out over time. And so, we do this quite a lot in our courses, where students will hear us say the same thing over and over and over and over, so that we drill in those kind of key bits of information that they're not going to forget. But we also ask them the same questions over and over and over. And so by the time they've said it 3 times, and the person next to them said it 3 times, and the person at the front of the room's repeated it 3 or 4 times, they've heard it so many times that they can retrieve it at will. And so spaced repetitions or spaced repetitions of retrieval information, and retrieving information in the context of its use, and then aligning the learning and performance criteria. I think those 3 things, from the reading that I've done at least, those 3 things I think really encompass a very solid foundational way to approach learning, or teaching and learning.
Yeah, definitely. And spaced repetition is key in solidifying learning and memory. So if you think about you've crammed the night before a test, all right, and you try to retrieve that information after that test is gone, because you haven't kept going over it with space, because we need sleep to help to solidify those neural pathways as well. So, I've been guilty of this. You cram before a test, and then afterwards you sort of completely forget all about it. So yeah, when you go to a course or a conference, whatever it may be, have a mentoring session, the importance is space that repetition out as well. Give it a few days, a week, go over that content again, because then you're retrieving that information, you're accessing it, you're creating more efficiency through those neural pathways, and therefore then it can start to be transferred into more of a long-term memory. So yeah, that's really important, is spaced repetition.
Yeah, awesome. Okay, so Bo, what haven't we touched on here? The importance of mentoring, like quality mentoring. We've looked at and how that's useful in combination with your own research, when we say research, I'm not talking about conducting research, I mean reading information that's available and then challenging and questioning that. And then you've got formal learning, and like traditionally I've not been a massive fan of formal learning as a way of gaining information, because there's so many potential holes in it. But that in combination with other things, again, is a really useful thing. Is there anything more that you think people need to do?
Yeah, well, I sort of think the way that, a lot of people out there have gone into private practice on their own, and they may not have the opportunity to bounce ideas and have discussion and have debate with other people, which is key for adult learners. We need to be able to bring in our own experiences and then have conversation about a topic with different viewpoints to understand it better. So I think, yeah, as far as those different formats, we've got our doing your own research, looking at the literature, but then reflecting on it, trying to put it into your own words so that you could effectively explain it to someone. Absolutely seek information from mentors and colleagues and ask different opinions without trying to be right. And I think that's the key when you want to try to have a bit of a debate with someone, is don't try to win. Sort of be quite analytical and consider the arguments, the different viewpoints, and see as the best you can. It's difficult to remove emotion, because when you've got emotion attached to a belief system, it's very hard to change. And when someone goes against your belief, that emotion amplifies and you become much more reactive.
Yeah.
Right. And when you're reactive, that fight, flight, or freeze, you lose the higher brain functions, and that prefrontal cortex. It's responsible for decision making, analytical processes. So, yeah, absolutely. See if you can try have some discussions with people about different topics. Because as adults, we learn really well in a social setting. But you've got to attend different formats of education, from conferences, workshops, could be webinars, could be YouTube, whatever it may be. I certainly don't think that one is the best and that you should only do one. Do it all if you can, little bits. Yeah.
That's a really good point. I like that point you made about, don't try to win a debate. Try to learn from the debate, or at least try to put your own beliefs on trial. See if you can find any holes in it. And if you have an argument or a debate with someone and you hold differing opinions, and you really allow them to attack your idea, and if they can pull it apart, well, then maybe it's not as strong as it should be. And that gives you both an opportunity to learn from each other. Then I think that's really useful. It takes a lot of knocking down the ego and being open to understanding other people's perspectives. But it's such a useful thing to be able to do.
Oh, it's hard. And we all think that we're not biased, but we are. Yeah. And, there's so many different forms of bias. I'm actually reading quite an interesting book. It's only small. It's called The Little Book of Stupidity. All different types of bias in there, and you read through and think, no, that's not me. But then you see an example. So there's a lot of bias attached to what we do, as much as we think that there's not. But the more aspects that we view this information from can help us to minimize the amount of bias.
Yeah, great. Bo, I think that's a really good discussion. Hopefully people have taken a bit away from that. I think that the main thing is that we just need to challenge our beliefs around our learning. I think a lot of the stuff that we've been taught, and look, we're both educators, we live in this world of teaching some of these old ideas a lot of the time. And I know I've been guilty of quoting some of these facts and figures about education and time and percentages of things that you remember and forget and so on. And this has opened up my eyes to ideas to a lot of different things. But I think we've just got to come back to remembering, and you made this point earlier, this people's learning styles are their preferences. It's not the way they absolutely learn best. And so if you've got a room full of people that says, oh, show us how to do it, don't tell us, because we're all visual and kinesthetic learners. Well, that's good. But if I just show you and let you experience it, you won't understand it necessarily. You'll just be able to do it. And that's not a three-dimensional understanding. We need to have all components to it. And so let's talk about it. Let's challenge it. Let's write. Let's ask questions. Let's debate it. Then we'll do it. And then we'll review what we did. And then we'll ask more questions and we'll build that scaffolding up as we go over time, right?
100%. That's perfect.
Cool. All right, Bo, let's wrap it up there. Thank you for that. Thanks everyone for tuning in, and we'll see you on the next episode.
Cheers.